So today I will tell you the uses of Gycodil EX. I'm your pharmacist, Dr. Abdur Rafy. I'm doctor of pharmacy. I have a specialty in pharmacy. I'm a drug expert, and you're watching Rafy Healthcare channel. So let's start. Its brand name is Gycodil EX and its generic active pharmaceutical ingredients are ammonium chloride, licorice powder extract, Adatoda vesica, Melva sylvestris. Here it is in these quantities. Basically, ammonium chloride is a chemical based, and these below three are plant based: licorice powder extract, Adatoda vesica, and Melva sylvestris. Melva sylvestris. So this is the cough and cold syrup. It is sugar free. It doesn't contain sugar, non-sedative. It doesn't cause any sedation, sleepiness. It is non-alcoholic, means it doesn't contain any alcohol. Now let's discuss its uses. Basically, Gycodil EX is an expectorant. It is used to treat productive cough. It takes out balgham by thinning it, and the cough takes it out from the lungs. Now we go to its indications. We have the Gycodil EX treats cough with bronchial and nasal congestion. It is also used to treat allergic cough. Gycodil EX contain ammonium chloride and herbs which help in excretion of balgham by making it thin. Gycodil EX also eliminates throat irritation. If the patient has irritation in his/her throat, it also soothes, decreases it. Gycodil EX has bronchodilatory effect. It dilates the bronchioles and helps patient to breathe easily. Gycodil EX has anti-inflammatory, antibacterial and antiviral effects, means it decreases inflammation and has some antibacterial and antiviral effects. Gycodil EX has decongestant, soothing and demulcent properties also. It treats the congestion and also soothes the respiratory system. Demulcing means it decreases inflammation. Okay, so these are the uses. It's a very good and effective cough syrup, but I would recommend you to first consult your physician and pharmacist. Why? Because if you have productive cough, it means you have balgham. Balgham produce if you have any infection or you have allergy, or there are a lot of factors which can cause balgham in your lungs. So you need to diagnose first that what's happening inside your lungs. Okay, why you are having productive cough, why you are having cough. Okay, so that's the reason. So you may require antibiotics and antivirals also, and other symptomatic medicines too. So you need physician and pharmacist for the correct treatment of yourself. Okay, so I would recommend you to consult your physician and pharmacist first, then use it. Okay, so I hope you understand the video. Please support me. I work very hard for you guys, so please support me. So I hope you found this video informative. Please like it, share it and subscribe to our channel. And if you have any question regarding this medicine or any kind of medicine, drop in the comment section. I will reply you. And now take care of yourself, and always remember your pharmacist Dr. Abdur Rafy in your prayers. Allah Hafiz and take care.